Thank you. The member for Durham.
Thank you very much, Mr. Speaker. Patience pays off. Anyway, please, a petition from the riding of Durham, which reads as follows. Whereas Health Canada approved Esbriet in October 2012 for individuals suffering with idiopathic pulmonary fibrosis, IPF, and whereas the Ministry of Health and Long-Term Care has declined to list Esbriet on the Ontario Drug Formulary or reimburse patients through their Exceptional Access Program, whereas Esbriet is the first of its kind in the world to be approved in Canada for the treatment of IPF and will slow the progression of this fatal disease. And whereas the high cost of Esbriet is creating financial hardships for many individuals and their families, only those patients who have access to a private drug plan can afford the cost of this medication, forcing some patients to go without treatment and die. Therefore, we, the undersigned, petition the Legislative Assembly of Ontario as follows: to review and reconsider the Ministry of Health and Long-Term Care decision to decline any assistance with Esbriet and consider some form of assistance with the cost of this medication in order to improve the lives of Ontarians with IPF and decrease the cost on the healthcare system associated with this disease. I'm pleased to sign it on behalf of my constituents in the riding of Durham.
Thank you.
New question, the member for Durham.
Yes, thank you very much, Mr. Speaker. My question to the Deputy Minister. Minister, Esbriet is a medication used for the treatment of mild to moderate forms of idiopathic pulmonary fibrosis,
Deputy Minister,
referred to as IPF. It was approved by the Ministry of Health in Ottawa in 2012 based on scientific evidence, and yet these studies concluded that 30,000 Canadian citizens are suffering with IPF, and the Canadian Pulmonary Foundation estimates that 5,000 patients in Ontario or in Canada will die this year. Patients like Byron Miles from Northumberland and Barb Skinner from Wellington Halton Hills, Virginia Curry from my riding of Durham, Hugh Detzler from Huron-Bruce. Your government and the Ministry of Health have let these families down and left them suffering with IPF. Minister, governments in Europe and the UK publicly fund access to Esbriet to improve their lives. Minister, the EAP process is not working. Will you help or look into relieving the patients that are suffering with IPF in Ontario?
Mr. Speaker, I recognize
just what? You said you asked the question of the Deputy Minister. I want to make sure it's a Deputy Premier. Deputy?
Yeah, I think we understood, Mr. Speaker. I recognize that Ontarians want to have access to new and effective drug therapies as quickly as possible. Our Ontario drug program offers, as you may know, more than 3,800 drugs now. New drugs approved by the Use of Health Canada are first reviewed by the Canadian Drug Expert Committee. With regards to Esbriet, the Canadian Drug Expert Committee recommended that Esbriet should not be funded because of inconsistent results. It is then up to each province to decide whether they want to fund the drug, as the member is now asking. We've established a process for approving drugs, an expert advisory committee that makes a recommendation based on the best available evidence. All brand-name drugs that come forward for review are now also considered through the Pan-Canadian Pricing Alliance. Given the concerns raised by the Canadian Drug Expert Committee, participating provinces and territories have decided not to engage in negotiations through the Pan-Canadian process at this time.
Supplementary.
I don't thank you for the answer because I don't think you're actually listening. These are families that are suffering with IPF, and you're not listening. Your EAP process does not work.
Nope.
A medical specialist in Toronto, Dr. Binney, from Toronto, strongly states that Esbriet should be publicly funded in Ontario as it is in other jurisdictions. Why are you denying the patients in Ontario access to a drug that is strongly recommended by experts? Your process is nothing but a block to access to health care in Ontario, and I'm asking you today to look at those studies and fund this for the people of Ontario.
Well, thank you, Mr. Speaker. And it's critical to appreciate the concerns that we all in this House share for families and those that are suffering. It is why we want to make sure that the proper drugs are being administered and are being approved by the experts who are providing it. And, Mr. Speaker, to the member's question, I am told that the Ministry of Health is gladly and appropriately reviewing any new evidence that that's available to manufacturing this drug for submission. So we are taking the actions and the proper steps necessary to protect those families, ensure that everyone receives the proper care at the right time. Thank you, Mr. Speaker.